Good morning, everyone. Welcome to this Resolution Foundation event, From Healthcare to Carers Care. I'm Mike Brewer, the Deputy Chief Executive here, and you're very welcome with us in person and online. The rising prevalence of ill health and disability has been under the spotlight recently, and not always in positive ways. There have been rows and political divisions about disability benefits, but today we'd like to step back a little bit from that and talk more about disabled people and also the family members who care for them. As Hannah will show you very shortly, disability and caring needs disproportionately affect the poorer half of Britain, and many of these families face a severe income penalty. So to talk us through the issues today, I'm very pleased to be joined by four other speakers. Emily Holtzhausen is the Director of Policy and Public Affairs at Carers UK. David Goodhart is a journalist, author and think tanker who's done many things in his career but currently head of the demography unit at Policy Exchange. And Abby Jachendra is a principal policy advisor at the Joseph Rowntree Foundation, where she leads their work on care, family and relationships. We're very looking forward to very much hearing from them. Before we do that, we'll hear from Hannah Slaughter, who's a senior economist here at the Resolution Foundation, and she will give you the highlights of a report we're publishing today, which, as ever, you can get from our website. Today's report is part of an 18-month project called Unsung Britain, which is looking at how life and living standards have changed for low to middle income households over the past 2 or 3 decades. And we're very grateful to JP Chase, who are supporting the whole project. As ever, if you're online, you can get involved by going to Slido, by asking questions, and there will be a poll later on. The code is Caring Impact. And if you're in the room, you can also ask questions on Slido, but there will also be a microphone if you want to talk to us in person. So we'll kick off with Hannah.
Thank you. As Mike said, thank you to JP Chase for funding this work, and also thanks to my co-author Imogen for working on this too. So as Mike said, disability has been very much in the spotlight recently, but today we want to zoom out and look at what are the impacts of disability and of caring responsibilities on the poorer half of Britain, who we call in this programme of work Unsung Britain. So this chart first is just showing the proportion of people reporting a disability in each of those groups. So you can see that the proportion of people who are disabled among low to middle income families has consistently been higher over the past 3 decades than the proportion among higher income families. And in the latest data, it stood at around 30% of working age adults in those families. But the less discussed kind of flip side of that is that in some of these cases, the kind of rising disability will mean a growing need for people to take care of them. That is something that often falls on friends and family. And so you can see from this chart that the share of adults in low to middle income families who are caring for someone who's disabled or elderly, and here we're defining care as kind of, includes disabled children, but it doesn't include kind of other forms of childcare. And around 10% of adults in low to middle income families are doing that kind of care. So it's a big part of their lives. And actually, we also go into the report, that low to middle income adults are also more likely to provide large amounts of care. So we find that around 1 million low to middle income adults care for at least 35 hours a week, so the equivalent of a full-time job. But it's also important to look at the overlap between the two, because obviously any given person might be disabled and also a carer themselves. And so this is first looking at what kind of overall among people, among working age adults, the proportions who are disabled or a carer. So the bottom bar there is low to middle income, and we see that around 1/3 of people in those families are either disabled or a carer, and actually 4% are both, and all of those proportions are higher than among higher income families. And then zooming out to the family level, so again, kind of low to middle income families at the bottom, and we find that 43% of low to middle income families includes a disabled member or a carer, and around 1 in 10 of these families, so 1.1 million low to middle income families, includes both a disabled person and a carer. And then just finally, this shows that around another 10% of these families don't include a disabled person or a carer within their kind of family unit, but do have a disabled person or a carer in their wider household. So this could be, for example, if you've got kind of a couple with kids and then kind of one of their older parents living with them, that kind of thing. So overall, more than half of low to middle income families is kind of directly affected by these trends in one way or another. But what we're really interested in the report is kind of highlighting the impacts that disability and caring can have on living standards. I mean, it's worth saying at the outset that this kind of causation can go in both ways. There's definitely a lot of evidence that kind of being on a lower income can itself contribute to disability and the need for caring in lots of cases. But we kind of focus here on kind of the other direction, so the ways in which being disabled or a carer can impact itself on living standards, and in some cases kind of push people into that low to middle income group. And to do that, we look at some quant data, but we also ran 3 focus groups at the end of last year with disabled people and carers to understand from disabled people and carers directly what the impacts have been and what their experiences were. So this is one quote from one of our participants, kind of highlighting that kind of impact on the previous slide around when you have a disabled person and a carer in the same family. One of the ways that could manifest is like in the case of this person here, who their partner had to stop working due to a disability, and they had to go down to part-time work in order to care for them. And we see that kind of really strikingly when we look at the quantitative data, that kind of income hit that you can experience for families with a disabled person or a carer. So this is just first showing relative to a family with neither a disabled person nor a carer, after adjusting for things like age, things like kind of household composition, what is the income gap for families with a carer, families with a disabled person, and families with both. And this shows that the kind of income gaps are quite substantial, particularly for families with a disabled member and families with also a carer as well. This is kind of a standard measure of income, but you could also argue that we shouldn't be counting as part of income certain disability benefits, things like personal independence payments that are not intended to replace income, but to cover the extra costs of a disability. So you can kind of see those arguably as kind of going kind of straight onto covering extra costs rather than income. And if we measure income excluding those kinds of benefits, we get bigger penalties still, rising to £3,100 for families with a carer, £5,600 a year for families with a disabled member, and £7,600 for families with both. So really quite substantial income hits, and you could kind of go further and think about kind of the extra costs on top of what is covered by disability benefits. We don't do that here, but disability charities have done lots of great work on that too. So one of the most obvious kind of ways in which disability and caring can affect incomes is through limiting people's ability to do paid work. And there's been a lot of discussion in recent years around people who are out of the workforce completely due to ill health, but one of the kind of really core messages coming out of our focus groups was that it's actually not always very helpful to think about the kind of binary distinction between people who are in work, people who are out of work. A lot of the time, people with disabilities and caring responsibilities can work, but need kind of certain kind of types of work, or can only work part-time, for example, or they might be out of work for some periods of time and then kind of moving into work at other times. And this is just a couple of examples of what people told us the impacts on their paid work were. So the first one was someone who was kind of at the time out of work, out of paid work, and had health conditions, and talked about being unable to do jobs that kind of relied on working with the public due to a fluctuating condition. And the second one is from a carer who had needed to kind of get a job more locally and to reduce their hours in order to care for their partner who was disabled. So there's kind of a really broad range of impacts on the employment beyond just being kind of unable to work. Again, kind of looking at the quantitative data, this kind of shows up there too. So the top bar here is the proportion of disabled people in low to middle income families who report that they're economically inactive due to their health condition, which is around a third. But actually even among those who are in work, so those 3 bars kind of a bit further down, more than half of people report each of these kind of limitations on the type of or amount of paid work they can do, be it their kind of physical health or mental health affecting what kind of work they can do. And similarly, when it comes to carers, so among low to middle income carers, just over a third say that their care responsibilities mean that they're unable to work at all. And it's also worth saying that that kind of number of kind of carers who are unable to work due to their caring responsibilities has risen by about 130,000 over since 2010, even as we've made really welcome progress on kind of fewer people not working due to childcare. So that's kind of a sort of growing phenomenon. But again, even among those who are in work, around 2/5, 41% say that they're not able to work as much as they would like. So it's really important to think about kind of the impacts on paid work in the round. And a lot of kind of what people told us in the focus groups was really helpful in enabling them to work was kind of flexibility. And that can sometimes manifest in people taking less secure forms of work, which is kind of here we're looking at things, flexible contracts, so things like 0 hours contracts, solo self-employment and working in the gig economy. People who are disabled and people who are disabled and also a carer are particularly likely to be in these forms of work. People did speak really positively about those forms of work, enabling them to work when they might not have been able to otherwise, but there are also big trade-offs that people spoke about. So things like, you know, unpredictable hours, meaning that their income was unpredictable, or for people who are self-employed, not having things like sick pay or other employment rights that employees might get, which made it more difficult for them to kind of manage, particularly when they were managing a health condition, for example. So paid work is really important, and actually lots of people in our focus groups were, you know, really wanted to do paid work, but of course, like, that's not going to be possible or desirable all of the time and for all disabled people and all carers. And so the benefit system is really essential here in protecting living standards. But unfortunately, we find that that isn't adequately happening. So this chart is showing the proportion of people in material deprivation. So that's a kind of measure of the extent to which people are unable to afford things like being able to repair or replace broken electrical goods, put £10 a month away in savings. And we see that while the share of all working age adults who are in material deprivation is 23%, that rises quite substantially to 60% of people receiving carers allowance and upwards of 70% among people receiving the health and carers elements of universal credit, and it's that's kind of slightly higher, although similar to the overall rate among universal credit recipients. There are wider kind of issues that people highlighted with the benefit system. So carers allowance is a really important one. There's been kind of quite shocking reports recently, in recent months, around kind of people accruing overpayment debts, because if you receive carers allowance, your benefit stops once you earn more than £196 a week, and that's a kind of sharp cliff edge. That's led to people inadvertently kind of accruing debts, but it also just means, like, for people like this participant in one of our focus groups who really wanted to work but was having to keep their hours below that £196 a week limit, and kind of creates a real disincentive to work, or just kind of makes it really difficult and really challenging. And people also told us about how complex the benefit system is to navigate, and you know that's definitely been highlighted in a more general sense in other research. But when you're dealing with a disability, when you're dealing with caring responsibilities, and especially if people talked about if they're claiming at a point where they'd suddenly become unwell or had suddenly had to take on caring responsibilities, it can be a real challenge. So the first quote here is from someone who described the system as a head mess, and kind of talked about the stress and the challenge of having to fill in loads of forms at a point when they were kind of really unwell. And the second one is from someone caring for their disabled adult child who was having to kind of spend a lot of time filling in lots of different forms for the kind of disability benefits for their child and for the carers benefits for themselves. So really kind of adding another thing to the mental load for people who will often, in these cases, dealing with a lot already. So just to end on what can we do about this, and so we kind of propose three kind of ways that policy can support carers as a starting point. So firstly, on paid work. So the measures in the Employment Rights Bill are really welcome in general, but given that carers and disabled people are kind of more likely to be on these kinds of things like 0 hours contracts, those kind of measures will disproportionately affect them. But we also think that the government should introduce paid carers leave. So currently carers leave is 1 week, it's unpaid. We think that should be extended to 4 weeks, and with the first 2 weeks paid, so that it's accessible to low income carers. We know that in the case of sick pay and sick leave, that's a really important way of helping people remain in work when they're unwell, and there's a kind of similar argument there for carers. On the benefit system, there's obviously kind of lots of discussion around disability benefits, which we're not going to kind of get into here, but there's kind of more that could be done on the carers side. So there's already a review going on around carers allowance in response to the kind of overpayments, and we think that the best way of kind of getting rid of that cliff edge where people just lose their benefits entirely once they earn £196 a week. The best way of dealing with that is with an earnings taper. That would be consistent with the rest of the benefit system and be a sensible way of dealing with it. And we also recommend kind of to start to deal with the kind of adequacy question in the first instance, to equalise the carers element of universal credit to match the health element, which will be, once the kind of new rate of UC Health comes in next year, will mean around £15 or £16 a month. So not massive, but we'll kind of start to address that issue. And finally, we're mainly talking today about kind of, our report mainly talks about kind of living standards, but we also recognise the role of public services. So there's definitely, of course, a role for formal social care, and that's something the government's aware of. It's something they're doing a review into at the moment, which we'll report in a couple of years' time. But we also recommend that local authorities should restore in-kind support to unpaid carers, so things like respite care, to kind of support unpaid carers with kind of often a really difficult job, but also to kind of reflect the value that unpaid carers deliver. I think that's it.
Thank you very much, Hannah. Great, and now our panel will respond to that, starting with Emily. Emily, you've worked a very long time at Carers UK. They're really pleased to have you here and to benefit from your experience and wisdom. So, what do you want?
Well, thank you very much, and thank you for a beautiful report as well. I'm absolutely delighted that you've been concentrating on carers, and I think the title also really reflects how carers feel and how they're sometimes treated, that they feel sometimes invisible, and yet it's something that most of us will do in our lives. We have women have a 50-50 chance of providing care in their mid-40s and men in their mid-50s. So, it really hits within our working lives, and it's not something that we can predict. I just wanted to reflect on some of these things and the evidence base. First of all, the fact that you've looked at disabled people and carers, but within households and singularly. We also need to remember that caring is, as I said, a dynamic population. So about 1/3 of people start caring every year and 1/3 stop. But the income penalties can persist even if you stop caring, because once you leave the labour market, it's extremely difficult to get back in, and the age where you're most likely to be caring is late 40s and 50s. And these stats are also highly gendered as well. Women are far more likely to be providing more significant amounts of care and more likely to be working part-time. So when we look at the statistics and we look at the data, we ask people about their experiences, we find it very much reflects your focus groups. We find people working below their potential in terms of reducing their hours or reducing the level at which they could work. And the geographical proximity is also important. If it's working from home, it's been absolutely critical for people. So one of the carers who stood to lose their benefits under the, or previously under the DWP proposals, is currently going through restructuring. She works from home. She supports her husband, who is at high risk of falling and choking. So she needs to work home, and she has 2 kids. So for her, she needs to get another job that has similar types of flexibilities. But if I come to your recommendations, your paid carers leave recommendation, for example, is so cost effective. There's a tendency to think if we give somebody something like paid carers leave, everyone will use it. And what I think is what's so important is that we look at real life usage, real world data. So if we look at that, if we just did a 1 week of paid carers leave, paid at a statutory rate, which is, employers recompensed by government, it would cost between 5 and 32 million a year, just for 1 week. I mean, that's extremely cost effective when you think of the protective effects. One recent government stat was that £37 million has gone from the economy as a result of carers giving up work and having ill health themselves. So we've got some very solid experience from employers like Centrica, for example, who think they've saved 3.1 million on the bottom line. They think would contribute 8 billion to the economy. We've got leaders like Phoenix Group and TSB who are again measuring all of these different take-ups. Sadly, the Employment Rights Bill last night, a beautiful amendment that we helped support and draft, got rejected by government. But what they have committed to is doing a consultation next year. So I hope that gives us the opportunity to come back to this. So very quickly, things like the taper on carers' allowance. This has a very strong behavioural effect. So there are some very simple administrative things that government could do to just improve transparency of how this works, but it's unbelievably complicated. We have 180 examples of heartbreaking overpayments. One carer who has a debt of £4,000 had to borrow money to pay it back. Didn't understand some of the rules which were about deductions and said, "What do you mean? I could have bought a pack of paper, a pack of printing paper, and offset that against my expenses." She was just over 40p over the limit, the weekly limit. But she had a £4,000 debt. Now that family is on universal credit, very low income. She's caring, so that absolutely needs to change. Really like the examples around health element. We've looked at slightly different things, and I think that's another proposal to put into the pot. And should come into this discussion about the overpayments review plus Get Britain Working and Keep Britain Working, very important. And finally, social care. The link between social care and keeping carers in work is not explored enough. We talk a lot about childcare and as being a primary condition for work, but not necessarily social care. And as you said, there's a rise in the number here. We've seen a rise in the number of people providing more significant amounts of care, especially over 50 hours. The outcomes that people have from carers assessments, the practical outcomes have gone down in the last 5 years. And when we look at carers providing significant amounts of care have given up, 46% roughly said that social care could have made a difference. So there are lots of structural things that I think will make a difference. We're also wanting to explore the link between the 10-year plan, the NHS 10-year plan, and the support structure that will create around families to keep them healthier, to enable them to care and to juggle work where they want to, because they often want to. So the final point I'll end on is people's choice, their ability to protect against risk of low income. And it's very much reduced for carers. 62% of people don't have a choice about caring. They don't have a choice. And that's largely, they say, because there are no other care options available. That might be family or that might be community-based, a whole different range. But when people don't have a choice about this, there is a role actually for the state in protecting risk. And there's very limited ability at the moment for people to protect themselves against this risk. So, thank you.
Thank you very much, Emily. There are many great charts in the report, and Hannah chose selectively from them, and the one we could have shown is that breakdown by age and gender, which is definitely in there, figure 6. So yes, absolutely, it is definitely skewed towards sort of late middle age and with the gender bias as well. But thank you, David. What's your take on this?
Well, thank you. Well, I don't have Emily's very direct everyday knowledge of the care system. But I've just written a book called The Care Dilemma, which touches on some of these issues. I remember reading a year or so ago, Andy Haldane wrote a piece, I think in the Financial Times, talking about the doom loop. He loves doom loops. The doom loop between the rising number of very costly safety nets in British society and our low to non-existent growth. And of course, think tanks are always saying, but if we invest just a little bit more in these safety nets, we'll actually save money in the long run. And quite a lot of the time, that is not true. But actually, in this case, when we talk about the 5 million plus informal carers in this country, it really is true, as Emily was just describing. They are an absolutely invaluable part of the system. They save the NHS and the care system tens of billions of pounds every year. I think the proposals that you come up with, Hannah, in the report are very sensible ones. Basically a higher carers allowance, a higher earnings threshold. The taper is obviously sensible. We have so many cliff edges in our tax and welfare system. 1 month leave, which would bring us into line actually with a lot of European countries. And the whole point about that Emily points out, the greater visibility for this very large unsung group. Places. I'm sure these exist to some extent, but places where they can meet, either online or in real life. And sort of be more formally recognised as a sort of part of the system, which they're not really at the moment. Of course, our challenge as a society is how we can build the family even more into the health and care system. We have weaker families. We're going to have 2 million over 65s are childless, or I think by 2030, 2 million older people are going to be childless. So, but where the family is there, we're very poor at sort of building the family more into the system. There are so many things we could do. Incentivising, granny or grandpa annexes, making it easier for, and if we had more specialist housing for older people, which were again international outliers and having very little of it, particularly as families have become more dispersed in recent. They're either not there at all, or they become a lot more dispersed. Perhaps particularly actually at the higher end, middle class families, partly because of residential universities, people are often not living so close to each other. The system needs to be aware of that. And of course, as you were saying, we need the interaction between informal care and the social care system is crucial to the system functioning properly. Wes Streeting, when he made his announcement the other day, I barely mentioned social care again. Social care, the Cinderella service, it's like sort of FE in relation to higher education. Its lobbying power, its presence is so limited in our political system. And I think, there's all this rhetoric about, turning the NHS into a more preventative system. The preventative service actually should be the social care service. Social care has an ongoing and intimate relationship with people, whether they're working age, disabled or elderly people in care homes or receiving domiciliary care. The NHS sort of by its nature has a more sort of transactional relationship with us. That we should rebrand social care as the preventative service. The NHS is there to sort out whatever your problem is and get you out the back door as quickly as possible. Social care's job is to prevent you going in the front door of the hospital in the first place, and we need to think about it more like that. Obviously, we need a higher minimum wage for social care. The cost would not be that great. We're going to probably need it now that the the visas for for international flows have been cut off. We also need, I think a simple way of raising the status of social care and saving the system billions would be to create a social care sort of profession that entailed a higher degree of training, not nothing like a kind of nurse or a doctor, but a social carer who can do basic sort of medical interventions, quite like basic wound care, giving injections, taking vital signs, and so on. The sort of thing that you could learn at a local FE college over a period of a year or something, taking a day or two. Now, obviously, you'd need to. At the moment, no care home has an incentive to build that kind of role into the system. You'd have to change the whole sort of contracting system. But that could potentially save the system billions. You wouldn't need the care home wouldn't need to call in the district nurse or the GP. But we need a lot of this actually did happen during the pandemic. A lot of care workers did find they were doing these kinds of interventions. Anyway, I do think, I know this is not really the subject today, but I think we do need also to continue this discussion about why disability levels are going through the roof. Now, there are obviously some sort of relatively simple answers to that, and the incentive systems have changed over the last 30 years. As unemployment benefits become harder to claim and less generous relative to disability payments. I also do think we have a kind of crisis of demoralisation in this country. I think being at the bottom end of a hierarchy is very stressful. And I think that feeds into, particularly in a society that thinks of itself as a meritocracy, that where people's place in the system is assigned according to their ability, which is sort of what we say we are, even if we're not actually in practice. And I think that increases the stress on people who are not doing very well in our society. And stress is very damaging to your health if it's a permanent, ongoing thing. And also, just the point that I make very much in my book, The Care Dilemma, is that the nature of the British family is, the British family is in a real mess. What is it? Nearly half of children in their early teens are not living with both of their biological parents. About 25% of families with dependent children are single parent families. We have a very, very weak family, and I think that is definitely one of the factors behind this epidemic of mental fragility, particularly among young people, which is showing up very much in the disability system. And what we do about that is obviously for another day, but I think that's all part of the background.
Thank you very much, David.
Thanks.
A very helpful reminder that in our report we very narrowly looked at the living standards and lives of disabled people in care, but it is all it is absolutely linked to the health service and social care and family. And I'm glad to see you also made your own proposal for a small amount of spending, saving billions in the future. So in true think tank style. Thank you, Abby.
Yeah, exactly. We're all at it. Thanks so much for having me on the panel, and I'd really echo Emily's thoughts on the sort of timeliness and analysis of this report. It's really helpful. So at JRF we've been doing lots of sort of similar thinking, looking at the experience of carers in interacting with the social care system, as David was talking about, reflecting on their sort of economic insecurity, as Emily was talking about, and I just give a plug for the Carer Poverty Coalition, which Carers UK lead and has been really pivotal in doing some of the policy thinking around the benefit system and how we might improve it. But today I'm going to talk about, I guess, one of the tensions that has come out in the reflections of the panel, which is, is the solution to this improving the formal social care system, or is it offering more support to carers so that they can care themselves? And ideally, we think it's both, but I think it is important to note that there is a tension there. So just to zoom out a little bit, what is the moment that we are in? So we are living, as we all know, it's become almost a bit of a cliche now, in an aging society. That means in practical terms in the last decade there are around, I think, 2 million more people over 65 in this country. And advances in health, which are really welcome, mean that more of us are living with a disability for longer. And this is, again, something that we should be really proud of, and is a real testament to the advances in technology and healthcare that we have. But it does pose some existential problems for how we deal with those. And so against this backdrop, care needs, we know, are growing and changing. And we also know that the paid care system, which David was talking about, is not keeping up with long waits for care and expensive costs for most people with anything over, very low levels of financial security. We also know from GRF research that the social care system is a black box for most people. So you don't know about it until you encounter it. And by then it's too late and it's often a nasty surprise. For example, we found that just a fifth of people knew that the average care home stay costs around £1,000 a week, which is significantly more than the entirety of the median salary. That's something you don't realise until it's too late, as I said, and we call it the care expectation gap. It's something which takes you by surprise. Nor do people know that they themselves may need to care and that this could be financially ruinous. As Emily said, the actual likelihood of you caring is much higher than people would care to think about, I think. And the problem is increasing. We've estimated at the JRF that the number of unpaid carers over the next decade is due to rise by about 1 million, which means many more of us will be doing unpaid care. So how do we meet this challenge? I really support the Resolution Foundation's kind of tripartite ask around the benefit system, the labour market and the formal care system. I would add to that the role of communities, and actually that there's a really important preventative role that social networks and communities can play in offering emotional support, which is one thing that we see in surveys people who need care are often missing out on. But I just talk a little bit about social care. So better funded care services are not just a wish, but a necessity if we're to meet these growing and changing care needs, which means a renewed focus on making care affordable and good quality. And I know that those of you that were around in 2017 might have an aversion to talking about care costs, but I think it is very important that we bring up those questions again. But returning to the tension between formal and informal care, formal care is a really important part of this. It's one of the drivers of the increased need for unpaid carers to care. It's not the same in other countries. We have better systems that don't rely so much on unpaid care. But we can't and we shouldn't try to design out unpaid care entirely. So for one, when JRF asked people why they cared themselves, the top reason was because they wanted to. And that means the government's plan for a national care service needs to include a focus on unpaid carers who are often advocates for the people they care for in these systems that can be complex and Byzantine. And beyond paid care, as the Resolution Foundation report sets out, we need to look at the benefit system, the labour market and community support, as I've said, to create a support system which meets people where they are. And we've asked, as David said in classic think tank style, for some more spend, which is definitely going to generate lots of returns, to go further than the month-long paid leave offer, which RF has proposed, to something like a statutory care pay entitlement, which looks like maternity leave, which we know does a very good job of keeping people in the labour market, and that will help people sort of stay in work and care at the same time, which could well be needed as care needs grow and more of us need to care. And finally, a note on politics. Care is expensive, formal care is expensive. As Emily says, paid care leave is affordable, but increasing the amount of money in the carers allowance system is not cheap. But it's also an area where support for change is broad. There's an opportunity here to deliver transformational change at the scale of the NHS if there is a government up for the challenge. There was some more in common polling that came out recently which showed that actually in terms of sort of concern for social care, Conservative voters were 10 points and Reform voters 20 points more likely to think of social care as a key concern than Labour voters. So finally, care is one of the things which makes us human. And it will not be enough to simply move the responsibility of doing care to the state, although that's really crucial. So we need to find ways that the state can help us care without, as this report has found, driving people into hardship. So I really welcome the report.
Thank you very much, Abby. Okay, great. We've got plenty of time for discussion and Q&A, which you can take part in by going to Slido, and the code is Caring Impact. Just before we do, I just want to say a bit about, I guess, the scope of the paper and the scope of the discussion. The subtitle definitely says disabilities and caring, and you may have noticed we spent a lot of time talking about caring and less about disability. And I think, well, we had the idea to do this paper nearly a year ago. Hannah, you started back in November, I think, last year. And since then, of course, the world has talked a lot about disability and disability benefits specifically. So we thought we would skew this paper a little bit more towards caring, but also try and bring out the interaction between the two, as Emily, you've already thanked us for doing that, but it particularly focused on those households where there are both people caring and people with disabilities, and sometimes the same person is caring and has disability. If you want to hear more about what we think about people with disabilities and how we can help them work, you should come back in a week's time when we'll be launching a report, which is sort of our contribution to the Mayfield review, which is going on at the moment. So that's next week. We'll talk definitely about how disabled people can stay and work. We've also spoken a lot about disabled people and the living standards and the benefit system in the past week. So today we will focus a bit more on the carers. So in the discussion, let's try and do it in 3 bits. We'll start with maybe some big picture trends. Then I'll talk about the living standards impact of care and what more we can do, what would actually help carers, and then a bit of hard policy and hard politics towards the end. But on the big picture trends. David touched on this. I think, when we started this project on Unserved Britain, we were trying to ask ourselves what has changed about low to middle income Britain. Probably the punchline. I'm giving away the punchline of our final report 6 months' time. It's probably going to be something about fertility is down, so there are fewer families with children. But as we get older and as we get a bit sicker, more carers there. But that's definitely going on, isn't it, Hannah?
Yeah, absolutely. As I said in passing in the presentation, so particularly when we look at kind of people out of work for both of those reasons, there's been kind of such welcome progress on kind of fewer people out of work because they're looking after children, and that's partly because fewer people are having children, but it's also because more people, and particularly more women, are able to kind of combine paid work and childcare. But certainly when it comes to other forms of caring, we're not seeing that same progress. I think we've got data back to about 2010, and there's been kind of a small kind of gradual rise, certainly among low-income families. So we definitely kind of need to take the impetus for the really welcome gains we've made on childcare and kind of extend that to thinking about other forms of caring as well.
Yeah. I mean, the analogy is definitely not perfect. Looking after your children is different from being carer for someone who's sick or disabled or elderly. But yeah, it does seem that we spent the 2000s thinking a great deal about childcare, and then maybe the 2020s when we need to think more about a different kind of care. And then Emily was saying earlier, you were applauding us for drawing the trends in caring. They haven't actually gone up that much, though. So what's more families with children, fewer dependent children, the number of people who say they are caring has not gone up that much, but it went up a bit, or quite a bit, when COVID hit. Is that something that is you think there is a COVID factor going on there? Is that what you
Yes,
see?
and your graph was one of the best that I've seen from Family Resources Survey, which shows that really rather large increase when it been sort of more or less static, moving around a bit. And I think COVID has had a bit of a long tail, to be honest. Right. So the numbers, when we did polling very quickly, what we found was, and because in polling we use we explain the definition, so we're far more likely to pick up carers who wouldn't identify themselves as carers, because people obviously see themselves as sort of partners, brothers, sisters, sons, nieces, nephews, good neighbours first. And that we saw a rise from 9.1 million to 13 million people who are caring. So they're much higher stats than the census, but it just gives you an indication of what happened when people cancelled services because of concern. I said this yesterday at the COVID-19 inquiry when I gave evidence. Services, of course, were withdrawn, they shut, fewer people to provide them. And really that hasn't returned. So things like day services have not returned. And that leaves families in a very challenging position of trying to find care. And the interesting thing is that all ageing societies face this very challenging issue about how to fund care, but the debate about the link between care and employment has been much slower to be made. So I would say we're about 20 to 30 years behind the childcare movement in making that link. And the same is true for disabled people and their support that they need to remain in work, remain in good health, remain in work and return as well when they're able to. I think it's quite useful that you've looked across other countries as well to look at what they do with paid carers leave. And Japan is a very good example of a super aging society that really increased paid rights within the employment because they needed to keep women in particular in the labour market. And we know that we're going to get a government as a pensions minister is going to have to make some decisions on pensions within this parliament and the review of the state pension age. And again, this is a critical issue, as if people are unable, I know you've done some fantastic work of what happens to the people in their 50s, why do they leave work, and what is the structure of that labour market. Caring becomes a very critical factor there.
Can I just ask something on that? I read a statistic that 400,000 people gave up work to care in 2021-22, which is an extraordinarily high number. I mean, for governments that worry about the employment rate, you'd have thought there'd be much more focus on that. I mean, was that perhaps unusually high because of COVID? And has it come down? I mean, do we have reliable numbers on how many people are giving up?
I haven't seen any further data to see that, but we definitely did see a change after COVID with people thinking, futures and retirements, and Resolution Foundation has done some great work on that. I think people have found it much more challenging, and the changing structure of families as well. People did think about 30 years ago, when people were looking at the future, they thought that perhaps people wouldn't care quite as much because social ties would be less, that divorce and different shapes of different families, actually care is still there. In other ways, it becomes more complicated or more intense. If you had 2 or 3 children where you have one, that is the sole responsibility, feels like the sole responsibility of one person, and we pull in nieces and nephews for people who don't have children, and broader networks. So when you talk about the future of housing, that's absolutely integral to this and ageing society. But for the here and now, it's kind of like a private emergency, if you like, in people's lives. And the graph that I want to also come back to is that I felt I've not seen it expressed like that about the material deprivation and carers on carer element within universal credit at 72%. It made me feel incredibly sad to see that is the lowest when carers give so much to society. £184 billion a year is the value of their care, which is the same as the NHS. So Don't Forget About Us is the perfect title. I'm sorry, I've gone off on some other topics, Mike.
Yes, that's fine. We'll definitely
but very important to us.
Thank you. We'll come back to policy. Policy at the end. Just on the big picture trends, then, and we'll touch on disability. I did notice the leader of the opposition party last week saying she didn't think that it was right to say that it couldn't be the case that a quarter of the population are disabled. But the graph that Hannah showed, which of course is even higher amongst low and middle income households, is coming from a household survey where people are asked whether they have a health condition or a health problem or a long-term condition which restricts the activities they can do in day-to-day life. So people are saying to a survey interviewer that they have a condition or disability which prevents them from doing things. It's not directly linked. That question is not directly linked to the benefit system. So I think it's a valid measure. I think it's a valid measure. We do know in the most recent years the rise has been particularly concentrated among young people, and is particularly amongst mental health problems. And David, you were touching on, I guess, the old Wilkinson and Pickett ideas at the spirit level, or Michael Marmot idea that the increased inequality causes anxiety, causes stress, makes just life is tougher. As you say, it is definitely not the case that we're a meritocratic society. So the idea that actually over these long periods of time, societies just become tougher.
Society is sort of more competitive.
Yes, exactly.
Society, go back sort of 30, 40, 50 years ago. It was sort of before the education revolution, in a way, before the idea that unless you get into the A-level stream and to university, you're going to live your life as a kind of second-class citizen. That wasn't the case a couple of generations back. There were kind of distinct, everybody had a kind of place in a way, not always necessarily a satisfactory one, but there were lots of kind of little ladders up, and then we gradually change things, so there was basically a single ladder up, and if you didn't get onto that ladder into university and into a professional job, you were considered an unsuccessful person, or you might consider yourself an unsuccessful person. And I think inequality has something to do with it, but I think there's also that sort of broader sort of context of the meritocracy or the faux meritocracy, the idea that at least we have that, and I think all the what we know about sort of stress levels and cortisol and so on. I think it really is a background factor in the sort of broader, as I said, that broader sense of demoralisation that people feel.
Thank you. Yes. Having said we're going to talk about caring, I then talk about disability, but I did want to make that. It was a good link between some sort of really core bits of social science from the last 2 decades. Are there any questions in the room, I wonder? There aren't many yet. We've got a couple. There is a roving microphone. Greg, if we could do the gentleman. Well, there's 2 hands, either order. We'll take them both, and then the panellists can respond to either.
Yeah, thanks very much.
And
thanks for a really great presentation. I just wanted to pick up on something.
Sorry, could you say who you are, where you're from?
I'm Shireen Kanji. I'm from the University of Greenwich.
Thank you.
So I wanted to ask Abby, you were saying that people do want to care. And I was just trying to put that together with the figures that we'd seen, or the graphs that we had seen earlier about how this is kind of so skewed socioeconomically, or, why is it that people on lower incomes are doing it? Is it because they want to do it more, or is it because their health is so much worse? Why is there that big disparity if everybody kind of wants to care?
Thank you.
Thank you very much. My name's James. I'm co-founder and CEO of Mobilise. We're very proud to be part of the Resolution Ventures portfolio. And I wonder, Carers UK did such a fantastic job of making sure that when those really outrageous injustices around carers allowance overpayments happened, that was kind of front and centre. And I think it really connected with a lot of people that this just felt wrong. And I also observe that with so many carers in the country, caring is never far away from anybody's personal life, which I think is really important. And I wonder, therefore, whether the panel, and Emily, I'd be interested in your views on this. Why is it? What are the barriers to making a much more high-profile policy case for carers? I think everybody on the panel has said that there is a really clear case for this, and yet we struggle to see carers rise to the top of the agenda when it comes to elections and policy making. I'd be really interested in hearing what your perception of the barriers are and what we might be able to do to overcome them, please.
Thank you very much. Any panel want to respond in any order? Abby, yep.
Yeah, I'm happy to start. I'm really glad you asked that question. So we have some research that's coming out relatively soon, which disaggregates that question around why you want to care, also by sort of higher and lower income carers. And you're completely right. So what we find is, so overall, the main reason why people want to care is because they say that they want to, or the people care is because they say that they want to. obviously behind that, there's, it's very hard from a survey to know, how much is that want structured by other kind of constraints in your life or duties. Gender is obviously another one that we haven't talked about as much. But one thing we do find when we disaggregate by lower and higher income is that people on lower incomes do have more constrained choices, and people on higher incomes have the ability to choose whether they will care themselves or whether they will rely on formal care. So absolutely, I mean, the Joseph Rowntree Foundation is an organisation that is centrally concerned with issues around sort of economic insecurity and hardship. So this is definitely not to say that, it's simply like, duty and goodwill that we should be relying on. There's definitely an income element here. But the point I think we do need to recognise is that, many of us do want to care, and many of us wish that we were able to more, but the labour market, the benefit system, the kind of formal care system doesn't allow us to in a way that we would like. So I think it's really about, as much as possible, embedding choice into the system. And we know that is possible because the richest among us do have that choice, even if, care costs are expensive, and that choice is there more. So I think that's sort of the change that we need to see to try and equalise that experience. And just, I might answer your question as well. Just with one thought, which is, I think Emily's phrase "private emergency" is a really helpful one. I think for decades, care has been the preserve of the home, the sort of domestic sphere. It's been private. I think it's only now that we are and carers are thinking that they deserve more, and it might be that the state might need to step in through a number of ways, not just through the formal care system, to support them. And so I think one really practical change is having more people talk about their caring experiences. I think during the last year's election, I think Ed Davies' ability to talk about his experiences was really a sort of step change, I think. And we can already see that political party sort of etching out a space in this debate very clearly. But yeah, I think trying to turn it from a private emergency to a public one is one sort of way to make it into a political movement.
Thank you. I was going to talk about the politics at the end, but let's do it now. Now you've raised it. Emily, do you want to respond to either points?
I'm really excited about the work that you're going to be bringing out soon about care. But the politics, it's really interesting because, Ed Davey launched his, it happened to be coincidence that when he launched his manifesto and you talked about his personal experiences, it also was day one of Carers Week. And for us, that was an incredible moment because here was high politics and somebody opening the door to what a lot of people keep private. And James, I know you know that very well. And it suddenly sort of burst onto the national agenda in a way that was quite different and connected with millions of people. And the Lib Dems have continued to keep that focus on carers, which has been incredible. I think why does it not really break through on politics? It's not on people's lips because it still remains a sort of a private issue. Don't you agree, Abby? And so when it comes to polling companies, we often don't see mention of social care. So not even these other issues about caring within the family. And people don't necessarily identify with the word carer either. So that's a policy term which is helpful, but it's not things that people identify with. And there is quite a strong cultural expectation that families will do this within all cultures. And that kind of underlays, as Abby was talking about, the tension between what do families provide and what does the state provide. And the low income families simply have fewer choices. Where we've seen the state in terms of social care provision shrink, so more carers being provided to fewer people, and there have been real term cuts as well in overall budgets. That preventative service, the low level service, is the stuff that families are having to pick up. We're seeing, quite a large proportion of families provide, do medical tasks as well. You might expect a nurse to do. So I think this dialogue, this is very, very important. The more we talk about caring and care and normalise it, the more we'll see, I think, bigger profile. But we do need our senior leaders to make this into an issue. Otherwise, we'll pay the economic and personal price of it.
Yeah.
It is. I mean, it is lower income people who are among the lucky people who get their social care paid for. I mean, it's only
Very low
the state
income.
covers.
It's only at the very, very,
Very,
bottom.
very
About 5% of over 65s who get full state support for social care. So it is a tiny number. I mean, I assume one of the differences between the sort of classes, as it were, is that lower income people are more likely still to live close to their elderly relatives in a way that middle class people are more likely to be dispersed, partly, as I say, because of residential higher education. And of course, middle class people can afford to pay for care, which lower income working class people often can't. So you'd sort of expect that difference. I mean, just on all the job surveys, I mean, the paid for work surveys say that people do get a huge level of satisfaction from care. I mean, it's almost the sort of inverse of income charts. You know, a lot of higher professional jobs have very low job satisfaction and high income, and a lot of very low paid social care type jobs or care type jobs get very good results on job satisfaction, but miserable pay.
Yeah.
I would just add to that, just on the kind of low income, high income dimension. It's also that if you are on a low income and you're making decisions with your siblings and your wider network about who should leave work to care, it makes the most sense for the person on the lowest income to lose that income rather than someone who's on a higher income. So that, I think people are, and we will all know this from our direct experience or wider networks. People are constantly having to navigate the challenges of a sort of inadequate system on one side and an inadequate system on the other side, and seeing how they can best give the care that a loved one needs within that.
Great, thank you. Right, let's move on to the living standards impact of care and what policy can do about it. We might rattle through this as we're getting towards the end. Let's do carers allowance and then employment rights bill and then universal credit. I mean, on carers allowance, I think my decree is that we need to stop calling it a cliff edge. It's an absolute precipice. I mean, a cliff edge is when you might lose your free school meals or your free prescriptions, but to lose 196 or 76, I've forgotten the answer to that number, that much a week, that's a precipice. And I think what both Hannah and Emily and Abby were sort of skirting around is that the problem is that's combined with DWP's inability to spot when someone goes over the threshold, and it's that combination of a precipice and administration that isn't working that leads to the huge debts that people can run up, which is just not seen anywhere else in the benefit system. So yeah, I mean, the more I hear about it, the kind of more horrified I get, and I'm a long way from the sharp end. I just wonder whether any of our panelists sort of had any idea of where the government review might be going, or any comments on how easy this is to reform it. Abby, I've forgotten what the Joseph Rowntree Foundation want in this area. we just wanted to solve that because it's such a bad policy.
No, I mean, so of the two questions, I mean, the first is we're hearing genuinely positive things from government. I mean, the review, I think, as I understand it, there are sort of two bits of the review. One is directly addressing the sort of overpayment question, and then one is a sort of wider conversation about carers allowance. And I think a taper is, absolutely the right thing to do. We need to drag carers allowance into the modern day. It's the oldest, or one of the oldest, or unchanged benefits in our system. I think in terms of what JRF wants, absolutely a taper. I think really focusing on carers in poverty, I think, is the right thing to do. I think when you start getting into increases to carers allowance across the board, you start getting into really existential questions around, should carers be paid a minimum wage, and what might that mean for the kind of regulations that we place. It's a bit of a Pandora's box. So I think really focusing on carers who absolutely deliver so much value and yet they're in poverty, I think that's a political consensus that we can build.
Thank you. And Emma, do you have hope this can be solved? DWP optimistic?
I hope.
You
so.
hope.
I always,
You hope it gets solved.
campaigners always have to be optimistic. We get knockbacks and no's all the time. So, Liz Sace, who's been appointed to run the independent review, is incredibly knowledgeable and very well respected, and has done a great job listening to people. So the taper is something that government has said they will be looking at, which is excellent. How does that work with universal credit? I think that's absolutely critical. And if there are a lot more other considerations, for example, if you get knocked off carers allowance, you lose your class 1 contributions to national insurance. There are further consequences. But I think at the bottom of this as well, it's one of the comments that in your report, Hannah and Imogen, about carers being overwhelmed by the administrative side of caring, which adds to stress and anxiety and ill health, as you talked about, David. And I hope that this benefit that has been left with archaic processes will be far more transparent. So in actual fact, you modernise this and you put the control and the knowledge back into the hands of people who are then able to make considered decisions and not be terrified of this earnings limit. They can decide, yes, I can take that extra hour work. Yes, I can do that. I will take the bonus. That often I think the administrative side is overlooked, but within the DWP, that can have some really large effects. As for carers allowance, of course, it needs to be reviewed. I agree 100% with my colleague Abby on that, and that's something that we've been calling for a long time.
Great, thank you. And then let me move on to the labour market and the employment rights bill. I mean, Hannah, I was really surprised at the facts you uncovered, or you and Imogen uncovered, on just how much insecure and type of work is being done by carers. I mean, I suppose it makes sense they're highly restricted, and Emily, you gave an example of why that might be. So they're highly restricted in their choice of jobs. But that does mean that there is potential then for the employment rights bill to make a disproportionate impact on carers' experience of the labour market.
Yeah, absolutely, and again, it's something that came out in the focus groups we did, as well as the quantitative analysis. People kind of having to choose things like 0 hours contracts, things like kind of more insecure forms of self-employment, to get the flexibility they needed, because it was hard to get flexibility or know where there was flexibility in kind of less, in more traditional forms of work, if we could put it that way. So absolutely, the measures in the employment rights bill will be beneficial, kind of giving people more security over their hours, some of the kind of longer term reforms around worker status, making sure that people are not kind of misclassified as self-employed and missing out on those rights when they should be getting them. And then I guess the other thing I just wanted to kind of mention is that we've talked a bit about kind of social care and kind of the social care workforce. And there's obviously kind of in the employment rights bill kind of really kind of welcome, ambitious kind of reforms ahead for the social care sector in the form of this adult social care negotiating body, the Fair Pay Agreement, as it's been called kind of in the past. And I think that's really important, both because we know that kind of the role of social care workers is so important, and kind of like making sure that the kind of amount of care is there, and kind of bringing people into, as I think David mentioned earlier, kind of we're needing to kind of bring more people into the sector in the absence of kind of visas, but also because of that could be kind of really important in increasing the quality of care, and definitely kind of coming back to that point about kind of the tension between formal and informal social care. It's some of the people in our focus groups talked about kind of it not wanting to go down the route of formal social care because they'd had bad experiences in the past with the quality. So I think we quoted in the report someone who had said that their mum had been kind of looked after through formal social care. They'd had bad experiences and they didn't want to do that with their dad. There were other examples too, but I think there's kind of like there's benefits across the board for disabled people and carers, but also kind of real kind of gains to be had in the formal social care sector from the Employment Rights Bill.
Thank you. Hannah is plugging her forthcoming report on the social care sector, which will be out this autumn. On this theme of work and what carers can do, there is Martin online has asked a question about sort of job DWP advisors and carers on universal credit. But the question was how much are carers who hassled by universal credit, where their advisors don't accept the limitations that carers have when looking for paid work. This wasn't something that particularly came up with the people we spoke to, but I wonder whether Emily or Abby had any views on that one.
I'm very happy to pick this one up because advisors have discretion.
Right.
So certain benefits like carer's allowance or carer element, you're not required to do work-related activity, but if you don't get those benefits, there might be a whole range of reasons why you don't. But you still have caring responsibilities. Advisors have discretion to flex around your caring responsibilities. And of course, if they don't, it can be catastrophic because you're caught between, do I care? Can I, and what do I do? And how do I work? How do I go back to work? I think for us, that's at the heart of this. And the Institute for Employment Studies did a great report actually about return to work support organisations, and some collect data on carers, some don't, and the ones that did were then able to interrogate that data and look at the degree to which they were able to support and flex, and that's something that we'd like to see much more knowledgeable, tailored approach within universal credit that doesn't set people up to fail.
Right. I think we were wondering when we were doing our report also whether carers might need specific tailored advice from advisors.
They do.
So even those even where they're not required to look for work, there may be some who would actually like to work in the future, and or whether we wonder whether there was a case for DWP doing more to help that group.
There is, most definitely. Definitely, we need more care awareness training amongst advisors. But when we look at carers and their journey back to work, the things that matter to them are they don't want to start a job and fail. So some of the loss of benefit, again, coming back on and security there's an income issue. But they don't want to start a job within an employer that is not carer friendly. So flexibility, paid carers leave, those kinds of environments, jobs that work around them. And I think one of the questions that you've sort of also raised as part of your report is around caring being unpredictable, fluctuating conditions. You can't always predict what is going to happen. And that can be quite challenging. So job design is really important, and flexibility for carers. So.
Okay. Abby?
Yeah, absolutely. There's a writer and a carer, Emily Kenway, who refers to health and care needs as lawless. And I think, how do you create a labour market and a benefit system that meets these lawless needs? Well, I think many of the points that you've raised today, I think Hannah do that. I think one thing that really comes to me in these discussions is we need somewhere in government where you have the benefits kind of people and the labour market people and the care people all speaking together, and ideally at the sort of ministerial level. So another think tank bingo thing is to create a new committee or task force, but I do think that is this is something we need now. We're thinking too much about these systems in silos, and actually it's the way that they interact, which is experienced by carers very keenly. That's the crucial thing. So I'm hoping that the Casey Commission, which is obviously the government's conduit for finding a solution for social care, will be doing some of that work, bringing these people together and thinking in the round.
Mm-hmm. Thank you.
Some of that, can I just quickly come in there? Because some of that is happening already. So it's not just very high profile or known about, but chaired by Stephen Kinnock. There's a group with Stephen Timms and a couple of other ministers, DBT, Justin Madders, and which is looking as well, which has looked so far at carers and employment.
Thank you. And then I guess a final policy which we've all touched on is carers leave, and I think there the analogy with you made an analogy with maternity leave, and your organisation proposal is really closely drawing on that analogy. David's made the case for this. David and Emily made the case for this being an obvious sort of instant saving. I'm reminded of the furlough scheme. I've been doing my own, throwback to COVID over the last few reports, writing a report for the COVID inquiry, and they're there where we threw money at businesses and people to keep that connection between employers and employees, because we thought that if employees walked away from firms in a moment of crisis, it would be damaging to the economy. But that is exactly what some carers have to do when they're hit by a caring emergency because of the absence of paid leave. Right, they have to quit their jobs, and that's bad for them, bad for their employer, and bad for the country. So this one, I I know we're panels in violent agreement here, aren't they? But Hannah, any thoughts on this one?
No, I mean, I just think it's, we have in the report, so I don't think my microphone's actually working, I'm not sure.
Good.
In the report we kind of drew the comparison with parental leave, where it's kind of it's longer, it's 4 weeks, as in the parental leave not the parental leave you get when you have a child, like you first have a child, but the one that's kind of you can take some leave each year. But I think what we also thought was really important was making sure that at least some of that leave is paid, because we know from kind of the wider evidence that if it's not paid, then it's just not accessible. I think this was actually something that came out of your research, Emily, that it's just not accessible to people on low incomes if it's not paid, because people just can't afford to take that time out of work. So I think that is really crucial, not just having the leave, but also making sure that it's paid.
Yeah, and there are lots of great international examples in the report which we can draw on. We're running out.
Do we have final points? Well, I think a really important point you made about, there's a sort of taboo about this issue of the failures of the social care system. A lot of people not wanting to put their relatives into the care system. A lot of carers actually not being very good carers, which is another reason for raising its status and its pay. So I think that's a very important point. The final point I wanted to make is that underlying all of this, we have this ancient economic metric called GDP, which sort of tilts the way we think about something. There is so much productive work that happens in the non-market domestic realm, whether it's looking after babies or older people, and we need to think about that. We need to change the way that we actually measure work in the non-money economy. If you just sort of think about somebody giving up their work to look after an elderly parent who desperately doesn't want to go into a home, and they love that elderly parent, and perhaps they have a decent middle class job, they're on £60,000 a year or something, and they go part time. So the GDP economy loses £30,000, but the kind of well-being of probably both the carer and the elderly person rises. The state may save money from that person not needing state support. So we have a minus where it should be a plus. I know this. Diane Coyle's just written another book about GDP, which I reviewed for the Critics. So it used to be a kind of new agey issue, slightly new agey issue. Can we sort of replace GDP with something? A lot of quite hard-headed economists are now coming to the view that we really do need to do it, not just because of the care issue, because of lots of other issues too. So I think that you should have a session on that book.
Thank you, we may well do.
That book, David.
Did you?
Right.
Oh, sorry.
Okay.
I missed that one.
Great. I think we definitely run out of time, so I'll draw it to a close here. Thank you very much to all my panellists for a great discussion, and to you all for listening. Come back in a week's time to hear our report on how disabled people can be helped to stay in employment, which is another really, really big issue and relevant to lots of today's issues as well. But thank you all.